This is Radio Health Journal. I'm Reed Pence. This week, the vast number of children left behind when their parents die of COVID.
At about 1,300 people dying every day due to COVID-19, that translates into about 300 children losing a caregiver every single day.
Innocent lives affected forever when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
When you are defined as your roles, what ends up happening is that we often lose ourselves, we lose our identity. For years, I wasn't called Eve anymore. I was just called Zach's mom.
Understanding the many roles we play in life. Then,
squeeze, I feel like a term I picked up when I started really getting into conventions, and squeeze is to be so excited about something that you can't contain it.
Appreciating the geeky world of fandom. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
No one who's lived through the COVID-19 pandemic has been unaffected by it, likely forever in some small ways. But those survivors who've been affected perhaps the most are the youngest, children who've lost a parent or principal caregiver to COVID.
I think most Americans know that we're almost approaching 1 million lives lost in the United States, more than any other war, even the cataclysmic Civil War. But what's been not well known is that some of the cruelest pain has actually come to a group with the least capacity to understand and cope with it. So the magnitude, 167,000 children under 18 whose whole sky has fallen in the last 2 years.
That's John Bridgeland, who's been a White House policy official under presidents both Republican and Democrat, and now co-founder and CEO of the COVID Collaborative.
72,000 children lost a parent, 67,000 lost an in-home grandparent. A lot of homes, as you know, are led by grandparents. And then more than 13,000 children lost their only in-home caregiver. So they're completely at sea. They've lost a person in their life that's the single most important influence on them in terms of social and emotional development, education, and, of course, not just a parent or caregiver, but an income provider. So it's a devastating circumstance.
The number Bridgeland cites of kids who've lost a parent or in-home caregiver isn't speculation. It's the product of a study using data from the CDC and Census Bureau, led by Dr. Dan Treglia, associate professor at the University of Pennsylvania's School of Social Policy and Practice.
We came up with 167,000 children as of mid-November. And of course, that number is growing. It's growing not just kind of at the rate that we saw, but in fact, it's growing faster because through the fall, the deaths became younger. So at the current rate, at about 1,300 people dying every day due to COVID-19, that translates into about 300 children losing a caregiver every single day due to COVID-19 infection.
Treglia says for people in the field, that high number isn't surprising. But for the world as a whole, these children have no voice and no visibility. They're forgotten grievers.
The fact that it is expected does not make our findings and this estimate any easier to bear. This is a tragic number, and because this is something that isn't talked about often by policymakers, by the public in general, this is kind of a hidden problem, right? We title our report Hidden Pain. We know that parental loss has grown dramatically as a result of the COVID-19 pandemic. In general, about 5% of children lose a parent by the age of 15, and we see that number growing. And it is, while this is a universal problem, it's affecting families of every race, every ethnicity, every income status. We know that it is hitting low-income households and non-white households the hardest.
We know that the children and families who are disproportionately affected by this loss, before COVID, were already experiencing tremendous adversity. These are communities of color, people in poverty, people coping with all sorts of challenges. And now comes COVID roaring down the pike, and with the suffering and loss on top of what they're already coping with.
Add to that the fact that losing a parent to COVID is particularly difficult.
These parents and caregivers, have often died in lonely hospital beds and isolation wards. And so the children don't even have an experience to understand and certainly go on to cope with the experience of the loss.
COVID-19 deaths are often sudden, right? The parent might be going into the hospital and dying very soon after that. And so there is no time to prepare. And the literature tells us very clearly that sudden parental deaths affect children more harshly than long deaths as the result of a chronic illness. Second, many of the resources that children would lean on as a result of a parental loss may not be available to them or may not have been available to them than during some of the earlier days of the pandemic, for example, when schools are closed. And because there's so much need, the community resources that should be there and were stretched thin even before the pandemic are now bursting at the seams, and they need reinforcement as well, that we need to bolster that. And third, as I mentioned before, it is children facing prior social and economic adversities that are being hit the hardest. And so absolutely, these caregiver losses are likely worse than parent losses that we see at other times.
The COVID Collaborative is moving for collective action to help these kids. Without help, Bridgeland and Treglia say children who've lost parents to COVID may be severely affected.
What is the consequence of losing a parent generally, right? And that can be associated with high rates of depression, anxiety, alcohol and substance abuse, and suicide, lower rates of educational attainment and adult employment. And because so many of these children were facing economic or social adversity and challenges even before COVID-19, or maybe they faced additional challenges because of COVID-19, but before they lost a caregiver, they don't have all the resources that we would like them to have in order to cope and adapt. And so there is additional responsibility among governments, nonprofits, and the private sector to take action for these children. And remember, this isn't a problem that's just going to go away if we ignore it, because many of the issues faced by children that lose a parent or some other caregiver persist across the lifespan.
We actually know from decades of research about the devastating effects of parental loss on children, higher rates of anxiety, depression, even self-harm, suicide, certainly lower educational attainment, higher dropout rates from high school, not going on for post-secondary education, which most of the jobs in the economy today require some post-secondary training, and then obviously lower employment rates. And we know also we're doing interviews of children and families across the country. It's very raw, but we're hearing, particularly from the parents, text messages that indicate they're worried about self-harm from their kids, or they're worried they can't afford the grief counselor that they know their child so desperately needs. And so if we don't get these children the support they need, and soon, we know the effects can persist over a lifetime.
Those lifetime effects become especially important when we think about the number of children affected. Treglia says it's enough to create problems on a national scale for decades.
For these children, for these 167,000 children, and that's a growing number, of course, we need to think about that. This is something that will stay with them. For many children, they're going to have a short period of grief. They will access the resources around them, through their families, through their communities, and they'll be okay. But so many children, 5 to 10% of them, will not, and they're going to have complicated or traumatic grief, and they're going to see the worst social consequences. And we can help them and address their problems now, or we can spend years and extra dollars taking care of them for years to come.
To combat that, the COVID Collaborative is advocating a three-pronged approach. First, these children have to be identified to receive help.
Through schools, through pediatric healthcare settings, through what I consider the social first responders, teachers, guidance counselors, youth athletic leagues, faith-based organizations. Second, we need to provide those social emotional supports. And again, the infrastructure to do this is already out there. Mentoring programs already exist. The family bereavement program already exists. Mental health care clinics already exist. Telehealth already exists. We need to do more to make those resources more readily accessible and available, and to provide more capacity and grief training to those communities.
Much of that is on the community nonprofit side, but ramping those up will also take money. That's where Bridgeland says government comes in.
I would like governors and mayors to make this a priority in their states by improving the system for these highly vulnerable children and their families. They'll be improving the system for all children and families that are experiencing COVID loss. And I'd also like to see the White House and the president's personally experienced this with the loss of his wife and a child. His two remaining boys, obviously experienced the loss of a parent, so he can personally empathize with it. I'd like to see almost State of the Union or national commitment.
These children often have not just a caregiver, but a breadwinner as well. And so there are a few things that Congress and the White House and state local governments can do. Things like making the child tax credit that was revised by the American Rescue Plan, make that permanent, providing categorical eligibility for TANF, SNAP, and Medicaid, and taking unused dollars for those things and putting that money toward these children now. Preemptive outreach for TANF and SNAP for children that have now lost income and are now eligible for those programs. And more mainstream benefits like FEMA's reimbursement assistance program and Social Security death and survivors benefits. Let's make sure that the people that are eligible for those programs are getting those programs. And let's expand eligibility to make sure that all of these children who are facing a dire and severe need can get the help that they need.
One parallel, Bridgeland says, is the fund established by the federal government after the 9/11 attacks. The pandemic and the children affected by it are another national emergency, and this time much of the groundwork has already been laid. These programs already exist, and the money is already there.
Congress, through the recent legislation working with the administration, provided all sorts of supports for COVID relief, and a lot of that money is unused. So I think that they need to coordinate across agencies. There are mentoring programs, there's mental health and substance abuse programs. There are all these programs in government that already exist. So just repurpose some of those funds and the additional funds for COVID relief to help this highly vulnerable population. Even if you aren't compelled by the moral argument, the economic return on investment argument is significant. If you don't invest in these children, the social service system and taxpayers are going to have to invest in them down the road. So it makes even economic sense.
You can find out much more about the problem and the plans at covidcollaborative.us. More information about all of our guests is available on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
If your scientist says one thing and my scientist says another, who's to say who is right? And so it is this slow erosion of facts.
Doctors who spread lies about COVID. A little bit goes a long way.
Then needle phobia. A surprising number of people avoid doctors completely because of it.
I knew that if she reached up to pull that cord to indicate we're getting off the bus, I was going to get a shot, and I would go berserk.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.